response. And joining me now is Democratic Congressman Hakeem Jeffries, who represents parts of Brooklyn and Queens. Congressman, always good to talk to you.
Good to see you, Chris.
So first I want to get your response to this new policy. It was announced this afternoon by Governor Cuomo and Governor Christie, which is going to be essentially by executive order. We don't have paper on it, so we don't know what under what authority and what the protocol is, but they have announced mandatory quarantines for those who are screened in incoming airports as having had exposure. And we have the first example of that tonight of a healthcare worker apparently worked for Doctors Without Borders, like Dr. Craig Spencer, coming into Newark, being quarantined, developing a fever, I think en route, it appears, to University Hospital. What do you think of this new policy?
Well, I think it's an important step in the right direction and it's reasonable. The governors of both states have decided to proceed with an abundance of caution, given the fact that we've got our first Ebola case here. This is a city with more than 8 million people. We live close to each other. We work with each other. We travel close to each other. And so I think it's a reasonable step to take at this given moment.
I should note that the video that we're showing of the ambulance pulling up to University Hospital being greeted by the people in the hazmat gear, we do not have confirmation that is the woman in question. It doesn't seem an implausible assumption that it is, but we cannot definitively confirm that. I got to say, it's a little hard to stomach watching the House oversight hearings here. Because at one level, I think there are criticisms to be made, and I think that the situation that happened at Texas Presbyterian was less than ideal, and there were some breakdowns there. At the other level, it just feels like I don't really want to listen to infectious disease advice from some of your colleagues, frankly, or, turn this over to what is the least trusted institution in American life.
Well, the problem with congressional Republicans is that hypocrisy is not a constraint to anything that they say or anything that they do. I mean, these are congressional Republicans who are responsible for hundreds of billions of dollars of cuts over the last several years to the NIH, to the Center for Disease Control, to international aid organizations, to the Health and Human Services Department. Cuts that have had an impact. You can't just dramatically cut government agencies that are important, particularly in the context of a healthcare crisis, and expect that these government agencies will be able to perform at optimal levels.
Okay, but I think, do you think it is the case? I think it seems to me that you can make a case that these two things are independent, that whatever missteps happened were missteps that were independent of whatever funding constraints, right? I mean, it doesn't seem to me that there's a clear causal effect between whatever funding cuts there have been and whatever missteps we saw in Texas.
Well, certainly as it relates to the Texas case, but I think that in two important areas. One, the cuts in funding to the NIH over about a 10-year period, particularly accelerated over the last 4 years by congressional Republicans, have limited the ability to make further progress on the notion of a vaccine, right? So that is a clear causal relationship between cuts and our ability to more effectively deal with the situation. And apparently our ability to detect earlier what was happening in these West African countries was hampered in large measure by cuts to the government that were made related to our interaction with West Africa and the health things that are going on over there. So I think it's reasonable to say, listen, you can, on the one hand, claim that the Obama administration has dropped the ball or other health executives have dropped the ball without taking some of the responsibility for the things that have happened.
So the kind of policy du jour that everyone seems rallying around is this travel ban, okay? And I was thinking about this, Dr. Craig Spencer being cared for right now and everyone wishing him the best. And it seems to me you've got this crazy thing where people say, well, you can't have a travel ban because that will restrict medical professionals going there, who were the people we want to stop the outbreak. And then people say, well, you'd have a loophole for medical professionals. But as we are seeing with the woman who's checked into the University Hospital tonight, Dr. Craig, they are by far the most likely people to get it. So then what the hell is the point of the travel ban?
Well, it's a very complex situation, and I understand why there's some appeal to a travel ban sort of on first blush. But this is very complicated in terms of who actually is most likely to acquire Ebola based on their travels. And there's no reasonable case to be made that an outright travel ban should be put in place to exclude that would prohibit health officials or health administrators from going back and forth to be able to get this thing under control.
And yet what we are seeing, and from talking to Dr. Peter Hotez today, that those are the people, frankly, who are by far running the greatest risk. I mean, if we're going to see more cases here, it's more likely to be some of the very brave folks we've seen. Congressman Hakeem Jeffries,
thank you very much, Chris. Good to see you.
Thank you. All right. Much more in the breaking news out of New Jersey tonight I just mentioned, where we have just learned that a healthcare worker from Doctors Without